What's going on, guys? My name is Travis Price, and you are checking out Turning 65, where we take your questions about Medicare and Medicare private insurance and answer them for you. Again, my name is Travis Price. I am a licensed insurance agent that specializes in Medicare and senior health insurance. If you have questions concerning Medicare, the most common questions you can find answered at travisprice.com/turning65. We have some text and video presentations that gives you a great overview of Medicare and Medicare private insurance. And today's topic is going to be, what does Medicare cover? Now, I'm just going to lay some groundwork on what this video is going to be and what it's not going to be. First off, we're not going to give any specific numbers because Medicare's numbers, including cost, change every year. And so you may watch this video 5 years from now and the information would be incredibly inaccurate. And so we're going to cover the basic services and speak generally about cost, but we're not going to go into specific details on cost or how much is covered. Secondly, this is not going to be about Part D or Part C and a Medicare supplement. And the reason why is because you're going to see a card in a few seconds that pops up that actually explores both Medicare Part D, which is your prescription drug plan, and Medicare Part C, and choosing a Medicare supplement versus Medicare Advantage. And in order to keep this video compressed, we are going to just talk about original Medicare, which is A and B, because all of the services under A and B are also going to be covered under Medicare Advantage. All right, guys, we're going to start off with Part A. Part A is premium free for most Americans because either you or your spouse has worked 40 credit hours or 10 years making money and paying Medicare taxes. So this is what you get for your Medicare taxes. It's broken into 3 sections, which is hospital care, skilled nursing care, and hospice. We're going to start with hospital care. Hospital care is an inpatient hospitalization. You usually pay a deductible for the first 60 days. Now, a hospitalization, that's only for one hospitalization. So if you discharge and you go through the benefit period, which is 60 days, and you don't go back into the hospital, you pay the new deductible, and then you go another 60 days without having to pay anything more than the deductible, up to the maximum lifetime benefit. There's also a rehospitalization clause with hospital care within that benefit period. So again, you pay your deductible and you go into the hospital for 7 days. If you're rehospitalized from 60 days from the day you discharge, you do not pay that deductible again. It falls back into that schedule where you pay nothing extra for days 1 through 60, a daily amount from days 61 through 90, and then more of a daily amount through the rest of your hospitalization. Now, it's very important that when you're in the hospital, you make sure that you are inpatient versus under observation. Observation does not fall under Part A. It falls under Part B. There is no deductible for that time period. There is a Part B deductible, and then you pay 20% in co-insurance when you are in observation as opposed to when you are inpatient. So let's talk about what skilled nursing is. Skilled nursing is essentially when you need more specialized care and rehabilitation after a hospitalization. Not an observation, a hospitalization. It differs from long-term care, because skilled nursing is not custodial care. It's not to help you with your activities of daily living, dressing, cleaning, bathing, walking, those kind of things. It's to rehabilitate you with a licensed medical professional, such as an occupational therapist or an RN if you need dressing changes, or speech therapy or physical therapy. A good example would be if you went into the hospital and had a stroke. You had hemiparesis, which is when half of your body is paralyzed and the other half isn't. And you have to go into physical or occupational therapy in order to recover. There are requirements that you have to meet in order to get skilled nursing care covered under Medicare. You are required to go for a 3-day hospitalization, not observation, hospitalization, and then a doctor has to sign off and continue to say it's medically necessary. The limits to skilled nursing facilities are that the first 20 days falls within your Part A deductible that you paid when you went into the hospital. Days 1 through 20 do not cost you anything additional. After days 1 through 20, you are required to pay a per day copay that continues to increase the longer that you are there. So let's talk about what hospice is. Hospice is when you are terminally ill, you waive all treatment options, and it is pain management and making you more comfortable. It's also known as palliative care. It's covered by you stopping all medical treatment of your condition, and it's only there to manage your pain. Overall, you pay very little out of pocket for hospice care. You have to, a doctor has to sign off on the fact that you're going to probably pass away in the next 6 months. So you may pay a small amount for your prescriptions, and hospice care does not inpatient hospice program. It's an at-home hospice program. So Part B, unlike Part A, you're going to have a monthly premium. I have a video that you can check out. A card will pop up in a moment that tells you about the options that you have to pay for your Part B premium. If you're receiving Social Security, it's going to come out of your Social Security check. If you are not receiving Social Security, you have the option to pay monthly or quarterly, depending on how you pay. It covers things such as your doctor's visit and other outpatient therapy services, such as physical therapy or other occupational therapy. It also covers many or some preventative services like the flu shot in the hospital setting, or if you have prescriptions that are required to be administered under the care of a doctor. So if you have injections because of your knee, that falls under Part B. And finally, durable medical equipment, which is things like walkers, canes that are considered medically necessary by a doctor. We can talk about durable medical equipment very briefly. It's covered 20% after you meet your deductible under original Medicare. That means that, let's say you need a wheelchair, you'll pay the annual deductible if you haven't already, plus 20%. So let's talk about diabetic supplies. Diabetes supplies usually, especially insulin is not going to be covered under durable medical equipment unless you have a insulin pump. So if you are just getting your injections, your diabetic insulin is not going to be covered under Part B. Furthermore, some of your diabetic supplies may be covered, such as insulin or blood sugar strips under Part B. They need to be having your doctor and the medical supply store accepting assignment through Medicare in order to get coverage for those supplies. So you want to make sure that that happens for both of your doctor and the medical supply store. So generally, the things that aren't covered with Medicare are routine dental, vision, and hearing. There is some coverage when it comes to cataracts, the surgery, and then the follow-up vision exam and one pair of glasses. However, most routine dental, vision, and hearing is not covered under Medicare. While Medicare does cover skilled nursing facilities with a qualifying hospitalization, it will not cover long-term custodial care. That is covered either under long-term care insurance or you pay for it out of pocket. And finally, Medicare does not cover non-medically necessary services such as cosmetic surgery. There may be some cosmetic surgery associated with a medical condition that is medically necessary. However, it will not cover non-medically required services. And finally, Medicare will not cover any treatment that is not covered by the FDA. So if the FDA does not approve of it, Medicare will not cover for it. If you have any other question, please don't hesitate, if you're on YouTube, to leave the question in the comments. I do reply, and if I get enough questions or it seems like a question that somebody needs answered, we'll do an additional video. If you want additional answers to your Medicare questions on the most common questions, check out travisprice.com/turning65, and you should see 2 videos popping up right now. The first one should be how to select a Part D plan. That should be on your left, and on your right is the difference between a Medicare supplement and a Medicare Advantage plan. If you do have any questions, again, please feel free to reach out. Thank you so much for watching this video. Don't forget to subscribe if you are interested in additional questions being answered about Medicare, because I do upload videos on Sunday at 9 a.m. and take your common questions. Thank you so much for your time, and have a great day.